Well, if you've been watching the news, tennis legend Chris Evert announced that her ovarian cancer had come back. She was diagnosed with stage 1 ovarian cancer in January of 2022, had finished her chemotherapy, had successful surgery, but her cancer did return. Now, she has a family history of ovarian cancer. Her sister died in 2020 at the age of 62 from ovarian cancer. Evert is one of the greatest American tennis players that we've ever had, but several other prominent women have also been affected with ovarian cancer, such as Gilda Radner, who was a comedian, Coretta Scott King, the widow of Martin Luther King Jr. And the American Cancer Society estimates over 19,000 women, American women, will be diagnosed with ovarian cancer, and over 13,000 women will die from ovarian cancer. So today we're going to talk about some of the 5 early warning symptoms of ovarian cancer. If that sounds good to you, keep watching. Well, welcome back to my YouTube channel. My name is Dr. duPont. I'm a board-certified gynecologic oncologist, and today we're going to talk about the 5 early warning symptoms of ovarian cancer, things that you should know. Well, one of the things that I want you to know, so number 1 will be the symptoms. Again, the symptoms are more related to the gastrointestinal system. They'll be like bloating, pelvic pain, fullness, new onset heartburn, feeling full faster, only able to eat a few bites and then just feeling completely full. The GI symptoms are very common, but they're also confused with other things, such as, irritable bowel syndrome or a viral gastroenteritis. And those things are much more common than ovarian cancer. So if your doctor, wants to investigate that, that's not wrong, because most of the time you don't have cancer. Most of the time it is something else. But one thing that I have noticed over the years is that the symptoms are persistent. And when you talk to an ovarian cancer patient, most patients did have symptoms, but they were vague. And so if the symptoms are persistent, those are things that I want you to look out for and definitely see your physician for. The second thing is pelvic pain or fullness. So some women will notice, new onset, just having to just feel pressure or pelvic discomfort. Some women will have pain with intercourse that's new. For those patients, I usually will have them come to the office. I'll get an ultrasound. I'll do a pelvic exam, because as the masses on the ovary get bigger, they start to kind of cause problems like feeling full or having pelvic pain. Sometimes I've had patients tell me they have back pain or pain with intercourse. The third thing that I want you to know is that some women will have urinary changes where they may feel like they're having to use the restroom every few minutes, or they're leaking urine, or they've noticed that their bladder has changed. Oftentimes, that's because as the masses get bigger, they press on the bladder. Similar to a pregnant woman who has a baby, a lot of times they have to go to the restroom all the time because their bladder can't fill up quickly or can't expand as much as it used to because the baby's kind of pressing on the bladder. So those symptoms of urinary frequency or having to go more often are very common. The fourth thing that I want you to be aware of, some of the symptoms of new onset ovarian cancer or recurrence, is new onset heartburn. I recently had a patient that had this and had noticed over the summer they started having heartburn and never had heartburn before, hadn't changed her diet, but noticed that she just had more and more heartburn. Well, as you have a pelvic mass that gets bigger, it may start to cause more upper abdominal GI symptoms. And so new onset heartburn, feeling full faster, only able to eat a small amount at a time are some of the symptoms of that. And then the fifth thing that I want you to know is if you have a family history, you are at highest risk, or you are at a higher risk. So the incidence of ovarian cancer in American women is 1 in 78. So if we have 78 women, one of those women will get ovarian cancer in a room if you have 78 women together. Well, if you have a family history, your risk is much higher. So definitely know your family history. I've had patients over the years that maybe were adopted and didn't know their family history, or maybe, you have family members that just didn't talk about kind of those diseases or those female problems. It's good to try to figure out, what family members had, especially your sister, your mother, your brother, your father, your grandparents, those very close relatives. It's good to know because family history is very important. And also, what's also important is a family history of a gene mutation. So if you had someone that had an early onset cancer, we usually find that as age under 50, and they did get genetic testing, ask them if they're able to share the results with you, if they're willing to, because if there's a gene mutation in the family, it does affect others in the family. So if they're able to share that or willing to, that's something that's very important. So family history is very important. So today we talked about some of the 5 early warning signs of ovarian cancer, things I think you should know. I hope you found that helpful. I have put some other videos over this year about ovarian cancer, some of the symptoms. I had 2 podcasts with Mrs. Kathleen Maxian, who's president of the Ovarian Cancer Project. She does great work. Please look at her website and look at that video. We have a lot of helpful information. If you have any questions or comments, please put them in the comment box below. And thank you for watching to the very end. Have a good day, and I'll see you next time.